Good afternoon, everyone. We apologize for the delay. Thank you for joining Harlem United for our PrEP Aware Week questions and answer. I am Shantae Williams, Practice Administrator for Harlem United Health Services. We're excited to participate in the second annual PrEP Aware Week, led by the New York State Department of Health AIDS Institute. PrEP Aware Week is an opportunity to spread the word about PrEP. At Harlem United, we have been providing high-quality HIV/AIDS care since the first wave of the AIDS epidemic. Our mission is to provide healthcare, housing, supportive services to those most in need, fighting for our community right to access these services, equality without barriers of racism, stigma, or discrimination. At Harlem United, we serve communities that have been denied resources, people with low or no income, people who have experienced homelessness, or people of color. Our community has been impacted by the AIDS epidemic. PrEP is one of those many ways we provide HIV care and prevention to those who need it the most. Harlem United is a proud partner in the statewide Ends the AIDS Epidemic intervention. As part of that, Harlem United is committed to providing PrEP to patients who are at a higher risk of contracting HIV and want to take additional precautions. Today, we'll be talking all about PrEP. Our goal is to make sure you leave here with a full understanding of PrEP, how it helps prevent HIV, and whether it's right for you. First, we will speak to Dr. Douglas, an HIV specialist at Harlem United, and John Key, our nurse care team supervisor. They will give the facts about PrEP and start our conversation. And then Fiorella, one of our registered nurses, will interview Jacob about his experience taking PrEP, and that portion will be conducted in Spanish. Then all four of our speakers will answer questions that you can send in. Please use the chat to send in your questions throughout the event, and we will answer them at the end. Now I'd like to welcome Dr. Douglas and John to begin our conversation. Welcome, Dr. Douglas. Welcome, John.
Hello, Shante. Thanks for the introduction.
Thank you.
How are you? So, John, we're going to start. If you can just tell us, what is PrEP?
Okay, so as Shante introduced, my name is Dr. Douglas. I'm a family medicine provider here at Harlem United. I'm also an HIV specialist. So PrEP, yes, the big word PrEP, it's PrEP week. PrEP is pretty much a medication that people who are at risk for HIV would take daily to prevent or decrease the risk of acquiring HIV. Some of you might be familiar with PEP, which is also a medication that you would use after potential exposure. So PrEP is quite the opposite. It's something that you take prophylactically to prevent HIV. You take it daily. And there's other options. You can also take it episodically, or you can also take it on demand. But generally, it's currently used daily. You take it daily, and you pretty much should be protected from HIV. Just to add, it's another layer of protection. So patients are prescribed PrEP. It's not that we will tell them that you need to use PrEP and then you can have sex or any sexual contact without condoms, but it's another layer of protection in addition to safe sex, condom use, and other methods of preventing risky sexual behaviors.
Thank you, Dr. Douglas. My next question is, who can benefit from PrEP?
Great question. Thanks for asking that. I believe that any patient who does not have HIV and is a high risk of contracting HIV can benefit from PrEP. CDC recommends transgender individuals, men who have sex with men, or anyone who just wants, like Dr. Douglas said, an extra layer of security when having sex. Sometimes we have, CDC also recommends sex workers or anyone who injects themselves with drugs and do not have access to a needle exchange program, or any HIV negative individual who feels that their relationship may expose them to HIV for any reason would benefit from PrEP.
Thank you, John.
I just want to add, it's what John just said. you know, he did mention people at risk for of HIV infection. I just want to add that people of colors or people of color or minority population, it's PrEP is really underutilized. And I just want to use this forum to appeal to people of color to be aware of PrEP and to engage with your provider to prescribe PrEP.
Thank you, Dr. Douglas. And if I was interested in PrEP, how can someone access PrEP?
Another good question. You can speak to your provider, or even better, contact us at Harlem United and have one of the doctors see you. But for you to be given PrEP, you have to have a minimum criteria of having an HIV negative test, having no symptoms of acute HIV infection, your normal renal function, and a documented hepatitis B vaccine and vaccination status. Once you have met all that criteria, then the physician who you see can start you on PrEP.
Thank you.
Welcome.
So can you tell us, what are the side effects of PrEP?
All right, so generally the side effects are mild. In fact, the medication used for PrEP is a very common medicine that we've been using for a very long time to treat HIV. So most HIV providers or, you know, most physicians who might prescribe PrEP would be familiar with using this medicine. So it's not a medicine that was just recently put on the market. It's been around for quite a while. The only difference is that you, whenever you take this particular medication to as HIV treatment, you will be taking 3 medicine instead of 2 that you will be using for PrEP. So the side effect is generally, as I said, mild. Some people might have some fatigue, some headache. Some people might have nausea. Very commonly, I see people with loose stools. But most of the patients that they study the drug, most of the patients in those trials had very mild symptoms. We usually use the term of startup syndrome. So maybe 2 to 3 weeks, they might have these symptoms. And basically, as a physician, you just simply, you know, it's more reassurance and they manage their expectation during this startup time.
Thank you, Dr. Douglas. Thank you, John, for answering our commonly asked questions.
Welcome.
And before we move on, is there anything else, Dr. Douglas or John, you would like to add?
Yes. You know, John did mention that, you know, to be eligible for PrEP, you have to definitely be HIV negative, and that's important. That's the reason why when we prescribe PrEP, it's important for patients to come back every 3 months to be retested, because it would not be a good thing for someone to be on PrEP if they're HIV positive, because you essentially would be under treating them, and then it's easy for them to develop a resistance just using 2 medications. So you know, part of providing PrEP is important for us as physicians to know, even, you know, the supporting staff to know, or anyone who's going to be prescribing PrEP, is essential that, or important that the patient comes back every 3 months to be tested, and not only for HIV, but also for other STI, because, you know, PrEP just prevents HIV. It doesn't prevent gonorrhea, some common STI like gonorrhea, syphilis, or chlamydia. So they need to come in at 3 months to have their HIV tested. And in fact, you can use those three months visit to engage them in regards to other issues, to their preventive health, vaccinations for maybe Hep A, Hep B, and HPV, which are also sexually transmitted. So that 3 month visit is not just simply to have them, you know, do an HIV test. You can actually use it to engage them in more preventative and promotive health initiatives.
Thank you, Dr. Douglas, for that useful information. Now I'd like to welcome Fiorella and Jacob. Jacob will share his experience with us with taking PrEP. Welcome, Fiorella. Welcome, Jacob.
Hi, thank you, Shante. Muchas gracias, John y Dr. Douglas, por compartir esa información. Yo soy una enfermera aquí en Harlem United, en la clínica que se llama The Nest, y yo voy a presentar a Jacob y le voy a preguntar sobre su experiencia con PrEP. Hola, Jason, ¿cómo estás?
Hola, bien, gracias. ¿Y tú?
Bien, gracias. Bueno, te quería preguntar, ¿por qué decidiste empezar PrEP?
Bueno, decidí empezar PrEP por prevención. Quería mantenerme negativo. Cuando me mudé a Nueva York en 2014, escuché a amigos cercanos hablándome de PrEP y vi mucha publicidad, que fue algo que abrió mucho mi mente a todo el estigma de VIH. Entonces, aquí ver que la publicidad y que el Departamento de Salud se preocupa y promueve sin tapujos todo el cuidarnos, entonces me pareció muy interesante y decidí ir a Harlem United en 2014 cuando recién me mudé para acá. No tenía siquiera seguro médico, entonces fui a Harlem United y me ayudaron con todo. Me ayudaron a enrolarme con el seguro médico, me hicieron todas las pruebas de enfermedades venéreas y procedí pues a iniciar el tratamiento con PrEP.
Muchas gracias. ¿Y te hizo sentir más seguro acerca de su salud sexual?
Así es, sí, me dio mucha más seguridad, mucha tranquilidad, porque cuando tú miras la historia de la epidemia que hubo acá en Nueva York, entonces uno se asusta un poco, ¿cierto? Entonces me dio mucha más seguridad. Mis amigos cercanos que estaban en PrEP y otros que ya estaban en tratamiento, me recomendaron mucho el tratamiento. Entonces, estar en PrEP da mucha tranquilidad, puede uno disfrutar tranquila y abiertamente de su sexualidad, siguiendo teniendo otros cuidados, pero realmente es mucha paz mental la que da.
Y I'm going to ask Jason if he had any side effects with PrEP that were not very good. So, Jason, ¿tuviste efectos secundarios negativos?
Sí, tuve efectos secundarios. Los médicos obviamente me advirtieron que iban a ser aproximadamente de 2 a 3 semanas y efectivamente así fue. Durante las 2 primeras semanas tuve muchas pesadillas, entonces dormir era complicado, sudaba mucho, tenía pesadillas, estaba muy cansado. Así fuera que yo durmiera 8 o 10 horas, al siguiente día estaba como somnoliento, estaba muy cansado, pesadillas y náuseas. Tuve un poco de náuseas como los 3 primeros días, pero entendía que era mi cuerpo que estaba dando a la medicina y la medicina a mi cuerpo. Entonces, fueron 2 semanas más o menos que tuve como esos efectos secundarios y ya después de eso seguí tomando la pastilla diaria y no tuve ningún más efecto.
Muy bien. Y I'm also going to ask Jason, what would he tell someone that is considering trying out PrEP? Jason, ¿qué le dirías a alguien que está considerando empezar a tomar PrEP?
Que lo haga. Siempre recomiendo a mis amigos que no están en PrEP que lo hagan, a los que vienen acá, los que recién se mudan para acá, los que recién salen de una relación de pareja o monógama, siempre que lo tengan en mente, lo recomiendo mucho. Si resulta que tu cuerpo no lo toma bien porque tus riñones o tu hígado o tus huesos no están respondiendo de una manera positiva, pues ya sencillamente tomarás la decisión con tu médico de suspender el tratamiento. Pero siempre que tengas la oportunidad, les recomiendo a cualquiera que lo haga. Los efectos secundarios, de nuevo, los médicos te lo van a advertir. Van a ser 2, 3 máximo, pero después de eso va y eso es a diaria, entonces creo que realmente vale la pena hacerlo.
Muy bien. Yeah, now I'm going to ask Jason, how does he see PrEP in relation to the community? Entonces, Jason, ¿cómo ves PrEP en relación con la comunidad?
Bien, creo que a veces no lo podemos tomar un poco muy deportivo. Es muy claro y somos conscientes de que PrEP nos protege de VIH, pero no nos protege de otras enfermedades venéreas. Entonces, creo que tener que hablar abiertamente, ser muy honestos y el uso del condón es algo que debe seguir en la mesa al momento de ejercer nuestras prácticas sexuales y disfrutar de sexo.
Muchas gracias, Jason. Thank you, Jason.
Thank you, Jason. So Jason, I just wanted to ask you, why did you decide to start taking PrEP?
Okay, I decided to start using PrEP because when I moved to New York City, I started seeing all the publicity all over about PrEP, and I started seeing that the health department was very open with the publicity and encouraged the people to sign up for the program. And some of my closer friends here in the city, they were in PrEP already, and some of them they were in treatment already. So they encouraged me to sign up for PrEP, and I did it. I did it for prevention.
Thank you. And how has PrEP made you feel more confident about your sexual health?
It has gives me a lot of like peaceful mindfulness. Like it gives me a lot of peace on my mind when it comes to sex and when it comes to HIV. Because when you look back at the history, you will know that we had a huge epidemic of HIV here in New York City. So that it scary a little bit, especially to me when I was new here in the city. So uh, just to enjoy my sexuality with a little bit more of peace, that gave me the beer and PrEP.
Okay, thank you. And Dr. Douglas did touch base a little bit on side effects, but I wanted to ask you, did you experience any negative side effects when you started taking PrEP?
Yeah, I would not call them negative side effects. I would say like side effects definitely. But the doctor always will tell you like, yeah, during the first 2 or 3 weeks, you might feel you might have diarrhea, nausea, sleepy. And for me, it happened the first 2 weeks. I was super sleepy. I was like tired all the time, exhausted. Even if I sleep 8 or 10 hours, and next day I will be like sleepy. I'm very sleepy and a little nauseous as well. Little nauseous. And that's it. That was my side effect for 2 weeks. After that, everything went normal.
Perfect.
Um,
And what would you say to someone who was thinking of starting PrEP?
I would say jump to do it. I always encourage all of my friends and people who I talk about it to enroll in PrEP if they're negative because it will give you a lot of peace of mind and just do it. It's gonna be only 2 3 weeks of side effects, and if your bones or your kidneys or your liver don't take it properly, just you and your doctor will decide to get off of the treatment. But definitely, if you able to do it, jump to do it.
Shante, I just want to jump in there. Just John, thank you for sharing your experience. Yeah, just like he mentioned, in terms of the side effect, he mentioned bone and kidney. So that's another reason that it's important for patients to follow up every 3 months to be tested because there is a potential for the medication to affect your kidneys. Um, and also to affect the bone. So if you might be an elderly woman, because PrEP is indicated for everyone who consider themselves at risk for HIV and they might be at risk for osteopenia, osteoporosis, then the Truvada, which is one of the PrEP medication, might not be appropriate. There's another PrEP medication called Descovy, which is sort of a modified version of the Truvada that might be safer for someone who might have a kidney or a bone issue. But it's not, I mean, if you have like a borderline kidney issue or you might be at risk, then you would want to think about using the other medication, which is called Descovy. Yeah.
Thank you, Dr. Douglas. So I just wanted to thank Dr. Douglas, John, Jacob, and Fiorella for this helpful information. And now we're going to turn to our question and answer portion that we will answer in English and in Spanish. The first question that we have is, Dr. Douglas, if you can tell us what is in PrEP?
All right. So PrEP is pretty much it's comprised of two medication. One is called tenofovir and the other one is called emtricitabine. It's two medication in one. And in fact, as I mentioned earlier, this is two medications that we've been using for almost over 20 years to treat patients with HIV. So we have lots of experience with these two medications. We have a lot of safety data with these two medications. And they're very efficacious. And I should have mentioned it earlier. The thing with PrEP, the more you take it, we said it works, but studies have shown that the more adherent you are, the higher the protection. So generally the studies, patients are in studies or a controlled environment, so it protected them over 90%. But in everyday life, the adherence could drop off a bit. So patients need to know the more they take it, they're more protected. And this is especially important for women because the concentration of the drugs tend to be less in the cervicovaginal tissue as opposed to the anal region. So women especially need to be a little bit more adherent. So maybe John can attest to this. So maybe someone who say miss a pill a week, you might be fine. But for women, you probably might want to make sure you're taking that medication every single day to have protective levels.
Thank you. Thank you, Dr. Douglas. John Fiorella, do you want to add? John, you're on mute.
Sorry, I apologize. So I would like to just quickly add that when patients are being screened for PrEP, maybe they may not know what acute HIV infection signs and symptoms are. But some of those could be fever, swollen glands, sore throat, ulcers in the throat, weight loss, tired body aches, vomiting, and rashes. And it can occur within 1 to 4 weeks of infection. So just wanted to share that piece to patients who wanted to know.
Thank you.
And I just want to add to that, and it also goes to what I was alluding to earlier, that it's very important for patients to come in at that 3 months follow-up, or even more frequently, because there have been cases where people have been on PrEP and they've been, it's reported in the literature as being breakthrough HIV. So they develop acute HIV. Either they were not fully adherent or they got exposed to a virus, HIV virus that was extremely resistant to the current the PrEP. That's why the PrEP is just another layer. Condom use is also effective, so you wanna make sure that you also using condoms in addition to taking the PrEP.
Thank you, Dr. Douglas. And you mentioned that you need to come in every 3 months to follow up for a visit. Can you tell us what happens at those visits?
All right, so so pretty much at a 3 month visit, it's pretty much to do an HIV test. You would, just as John was saying, you would ask the patient if they had any recent, fever, rash, glandular swelling, anything that would indicate acute HIV infection. So it's a visit to ensure that they're not they don't have any symptoms of acute HIV. It's also a visit to make sure that they're fully adherent to their medication, they're not sharing it. And it's also most importantly to do additional STI screenings. As I said, PrEP doesn't prevent you from contracting syphilis, gonorrhea, or chlamydia, which are some of the most common STIs out there. So that 3 month visit is very important to to assess the patient and to check for these STI and treat if you have to, and also to check their kidneys to make sure that there is no accumulative effect, negative effect of the drug on the kidneys. As I mentioned earlier, it can affect the kidneys. So that's a very important time to see the patient. And also, it's pretty much just to engage them into your, keep them in care. Maybe they can share the information with their friends, their families, that might be at risk for HIV. So they could all come in and get PrEP pretty much.
Thank you. And is it okay to take other medications with PrEP, such as cholesterol, birth control?
Oh, certainly. As I said, we've been using this medication for quite some time. So there's not a lot of medications out there that could interact. Some of the common medications that people might use, over-the-counter medications for, say, people who are diabetic, hypertensive. There's no known interaction with these medicines that would prevent someone from taking PrEP. Although some transgender women that are using hormone therapy, they can be a decrease in the drug levels if you're on hormonal therapy. That's why it's important to be fully adherent taking your PrEP. But generally, the over-the-counter medication that most people might use, maybe a Maalox, Pepto-Bismol, over-the-counter OTC for pain. There is no known interaction with Truvada.
Thank you, Dr. Douglas. And another question we just received. Do I have to tell my partner if I'm using PrEP?
Oh, that's interesting. John did mention that it's approved for people who are in serodiscordant relationships. So someone might be HIV positive and they're in a relationship with someone who's negative. It's indicated for in such a scenario. I think it has to do with the relationship that you do have with this person. PrEP is pretty much an option for people to protect themselves. It puts your care in your own hand, especially women. Some people might not be able to negotiate safe sex, so you're pretty much taking your care in your own hand. And if it's not a relationship that you plan to be in the long term, then I don't think there's any reason that you should tell them that in PrEP. In fact, if that person might be at risk for HIV, then you maybe should encourage them to get into care so they can get PrEP.
Thank you. And Jacob, can you share your experience with us during your 3-month follow-up?
It's pretty simple. It's very easy. It's nothing out of this world. So you just do your appointment. They check your weight, of course. They ask you if you have if you have any R during past 3 months, if you have any effects or possible STI, something like that. And they do the blood work, of course. And 3 or 4 days later, you have emailed the result, or if there is something that you need to figure it out, like a treatment for syphilis, gonorrhea, whatever, they will call you back hey, get back to treatment. So it's very easy. It's very simple. It's every 3 months. I do it every 3 months. And of course, the doctor always say you your kidneys are okay, your liver okay, check out with the cholesterol, check out with the sugar, it's a little high, it's a little low. So I think it's important too, because it basically top basing all your body and all your health. So I like that too, because it's basically keep you in control when how your body is responding to the medication and with your lifestyle as well.
Thank you. Thank you, Jacob. And Jacob, can you tell us how you discuss your usage with PrEP with a partner?
I'm always bringing everything on the table. So I'm very open, a big mouth to speak. So I always speak out my mouth. So I always bring it on the table. I'm on PrEP. So this is what's going on. I think that you should do it too. So don't be scared to talk about it. I mean, we've been growing up in a culture, especially I come from a culture where we had a lot of gucci all the time, covering things and do not speak out about sexuality or safe sex. And I think that had to change. Is something that I had to change with the generation, and it's something that you see now teenagers being more aware than that when I was growing up. So I definitely think that my generation is breaking all those walls with all those barriers to speak out and being very open-minded to talk about it since being a teenager. So I always speak, so that's the thing.
Thank you, Jacob. So that will end our question and answer portion. Before we wrap up, Dr. Douglas, John Fiorella, is there any last words that you have?
Yeah, I'll go first. Yes, so as a provider here at Harlem United, I wanna just I just wanna send a message out that we're here. We're here to provide care. We're here to see that you get on Truvada, which is PrEP. Especially our folks of minority. I want to reach out to my Black women out there coming to Harlem United. PrEP is extremely underutilized in this population, and you might think that you're not at risk for HIV, but you could come in, you can sit with us, sit with a provider, sit with a nurse, and we can get you signed up so that you can put your health in your own hands by offering you PrEP.
I agree with Dr. Douglas that we should use this tool to better our community and better their health. And it's a good screening process when they come in for one thing, we can help them with other things. And then we can provide better access to healthcare for all those who come to see us.
Thank you. I want to thank all the panel. Thank you, Jacob, for sharing your experience with us. I want to thank our audience. If anyone is interested in PrEP, we're located Harlem United, the Nest Community Health Center. We're at 169 West 133rd Street. You can also reach us at 646-715-4995. Thank you.